My name is Lorna O'Shea and I'm the Regional Placement Facilitator in the discipline of Occupational Therapy. Today I'm going to be looking at the management of underperforming students, looking specifically at the Targeted Competency Pathway. The Targeted Competency Pathway is available in PDF version on our Practice Education website. It is a suggested framework to use with students who are perceived to be experiencing competency-related challenges on placement. It's very much a supportive tool and it's intended to assist both the practice educator and the student in their management of challenges they're experiencing, with the aim of effectively supporting the student to achieve a competent grade in their overall placement. Very important that the university-based practice education team support is involved from the get-go here, and very important that all support systems available to both the student and the practice educator are explored and encouraged throughout the process. So for the student, this may look like the college health service, college counselling service, college disability service, their own peers, the university-based practice education team. For the practice educator, that may involve their own supervisor, their manager, their peers from work, and in addition to that, the university-based practice education team. It's a 6-step process and it spans across 2 phases. So the first step is around identifying and validating the concerns. So what is the concern? What competency area does it relate to? What examples can you provide to validate your concern? What evidence is available to you and to the student? The second step is around managing the concerns and completing the relevant documentation. So in this case, it's going to be the concerns management form, which I'm going to discuss in further detail later on in the presentation. And this form will help to give structure and support to the concerns that are being raised. The concerns management form is then implemented for a period of time. That period is very definite. It's agreed and signed off by both the practice educator, the student, and the university-based practice education team. After that period of time, the form is reviewed, and in some cases, the pathway is now complete. The concerns have been addressed effectively, and the pathway is no longer required. In other cases, that may not happen, and the concerns are ongoing. So the concerns management form will need to be adapted to reflect that, and then the adapted concerns management form will need to be implemented for a definite period of time. Again, this time needs to be agreed by the practice educator, the student, and the university-based practice education team. After that period of time, the concerns management form will then be reviewed, and at that point it will be clear whether the student is entering into a high risk of failing their placement, or whether this can be managed effectively to avoid a non-competent grade. On the targeted competency pathway, there is a section which is called the performance warning signs, and this can be a very useful reference point for the practice educator. There are 6 examples given. It's a non-exhaustive list. I'm just going to pick 2 to discuss here. The third one on this slide is recurrent feedback of a negative nature from other OT staff and or members of the MDT regarding the student's behaviour and or actions in a professional context. So you may, for example, get feedback from a physiotherapist that you were working with that the student spoke very inappropriately to a client during a professional session. You then, as a practice educator, give direct feedback to the student. You ensure the feedback has been heard, it's been recorded, and yet you get that feedback of similar nature a second time, a third time, and it could be from the physio, it could be from another member of the MDT, a speech and language therapist who has similar concerns raised, similar examples. So again, if you are getting feedback like this, it's really important to listen to this feedback, take it on board, record it, and factor it into your concerns management form. Another example would be students' support requirements in coaching or practice educators' clinical and personal commitments on a consistent basis. If you as a practice educator are heavily supporting the student beyond your remit, whereby it is eating into your breakfast time, your lunch time, it's extending the length of your day, you're finding you have to spend excessive amount of time documenting feedback sessions with the student, completing concerns management forms, speaking with other members of the team, linking with the university-based practice education team, and it's significantly impacting on your clinical and personal commitments, and it's really affecting, I suppose, your management of your own caseload. Again, that's something that you really need to listen to consider, and to incorporate that into your concerns management form and the management of this case as well. Key considerations for any practice educator who is managing a student who is underperforming is acknowledging that it's very much a case-by-case basis. It's highly individual. It'll vary depending on the student, the circumstances, the context. Early communication is absolutely essential. Early communication with the student and with the university-based practice education team, so they can be involved in the process with you and support you through it. Consistent feedback, feedback that is clear, and feedback that is documented very carefully, and ensuring that the student has heard the feedback that has been provided. So after each time you're giving the student feedback, you're clarifying that the student has understood the feedback. I've just given you this piece of feedback relating to your communication. Can you please describe to me how you've interpreted this feedback? And ask them to explain to you what they've taken from the feedback provided. As I've already said, around clear communication, documenting relevant conversations, relevant supervision, informal and formal sessions that you're having with the student around the time, phone calls or conversations you're having with support mechanisms available to you. Decision making, then, it's very important that it is understood that the decision essentially lies with the practice educator, whether the student is not competent or competent. Which is a very difficult decision to make, and we do very much appreciate that. You will be supported in that decision making, you will be guided in that decision making, but the decision making will lie with you in relation to competent or not competent. Very important as a practice educator to consider meeting times for any of these sit down sessions you're having with the student, to look at the concerns management form, to look at this documentation, to have these difficult conversations. We would suggest that if meetings of this nature happen earlier on in the week or in the middle of the week, when supports are available to the student outside of their placement. Also that it's better that it happens earlier on the day versus later on in the day, again, so that the support mechanisms are available to the student. Should they become upset, should they become very stressed, it's just really important to consider the timing and be mindful of that with any meeting that you have with the student. There's lots of supporting documentation and resources available to you when you're dealing with an underperforming student. The key one is the concerns management form, which I've referenced already. It provides a record that a concern has been raised regarding the student's competency and that the management of such concern has commenced in a solution-focused and supportive manner. It really aims to assist the practice educator and the student in identifying and understanding the concern which has been raised and formulating a comprehensive action plan to address such concerns. The form has three parts. The first part is a summary of the concerns. The second part is exploring the student and the PE's perspectives. And the third part is creating that clear action plan to address the concerns that have been raised. Important that the student's details and data are recorded and that both the student and the practice educator sign off on the documentation once it's completed. If the form is commenced, as I said before, it's extremely important that the university-based practice education team are involved to support the management of this case. Looking in more detail into the three parts of the form, the first one, as I said, is a summary of the concerns. So in this section, you'll be looking at the competency area in which the concern has been raised. Is it relation to communication, occupation, professional development, professional behaviour? Which competency is it clearly related to? Specific components of the competency area in which the concern has been raised. So for example, if the concern is around communication, what specific area of communication is the concern relating to? Examples, so you're listing concrete examples of behaviours and actions observed which support the concern that you're raising as a practice educator. So of examples of things that you've witnessed or that have been reported by another colleague, and again making them as clear and as concrete as possible. Part two then is looking at the student and the PE's perspective. So thinking about potential causes of the difficulties that the student is experiencing, potential strategies to address the difficulties, and any other comments that either the practice educator and the student may have. The third section then is around the action plan. So specifying again the competency area and the concern identified, creating that short-term SMART goal relating to the concern, clearly outlining strategies and resources identified to target the goal, and agreeing on a review date that will be signed off by the student, the practice educator, and the university-based practice education team. An important note that's important, I suppose, to flag and to highlight in this presentation is that in cases whereby there's sufficient evidence to demonstrate that a student's action or inaction and or decision making whilst on placement is negatively impacting on the quality of client care and or service delivery of the placement site, and or in cases whereby the student's support requirements is encroaching on the practice educator's clinical and personal commitments on a consistent basis, the placement site and or discipline of occupational therapy reserve the right to overwrite the processes outlined in the pathway and to terminate the student's placement in advance of the completion date. In such cases, sufficient evidence and documentation must be made available to support the decision making, and all relevant stakeholders must be involved. There's a specific protocol relating to this, which is Protocol 28, which is available in the Practice Education Handbook and on the Practice Education website. Thank you for taking the time to listen to this presentation. If you have any questions, please contact the university-based Practice Education team. All contact details are listed on the Practice Education website.